When a person dies of Ebola, his body remains infectious. It has to be removed and buried by specially trained teams to prevent the spread of the virus. The safety practices are incompatible with some religious traditions, and that's where religious leaders play an important role, said Vice President Biden.
You understand the cultural difference. It's easy for an American or European to sit there and say, well, why are they doing it? Why are they burying somebody that way? Why don't they just understand? You get it, and you're the ones who are the most trusted, and so you've played a significant part in dealing with what is a cultural phenomenon in many places.
Biden made his remarks Thursday as the World Health Organization reported that the death toll from Ebola has reached 5,160. The organization says the real number is probably higher because many deaths go unreported. Liberia, Guinea, and Sierra Leone have been the hardest hit, but officials say the death toll is growing in Mali. The number of infected people worldwide has surpassed 14,000. But the organization also reports some improvement.
There is a trend now in Liberia showing a kind of decline in cases while being reported on a weekly basis. In some district in Guinea there is also kind of decline, but in Sierra Leone the numbers are still very high. What I can tell you is we should stay still very vigilant because things tend to change very quickly in Ebola.
Health officials are calling for more support in fighting Ebola in West Africa. They also stress the need for flexibility, as the spread of the virus can slow down in one place only to flare up in another.
As we adjust our strategy to the geographic dispersal of the disease, we need more Ebola treatment facilities, smaller ones, but more located in a dispersed manner, more community care centers, more partners on the ground to staff these centers, particularly giving the critical management skills to safely manage these facilities. We need greater mobility for the teams, and we need money to pay for it all.
Officials say that implementation of safe practices in treating Ebola patients and disposing of the victims' bodies have contributed to slowing down the spread of the disease in some areas. Several organizations are preparing to start clinical tests of new drugs and vaccines in West Africa that could prevent new infections and save lives of the people already infected. Zlatica Hoke, VOA News, Washington.